Can't be serious. You guys, it's taking me all day to get to this point. I'm trying to film this video. I'm trying so hard. So, anyway, y'all, this is surgery story number 107. I don't even want to say my name anymore. I don't even want to say hello. I don't want to say anything because people have things, they have jokes. Meanwhile, as I sit here trying to do this video, I got to deal with this. Do you see? How does anybody stay serious? How do you stay serious? How do you stay serious? I'm trying to focus. How do you stay serious? It's not, right? Anyway, big shout out to Oxígeno Vida, the hyperbaric chamber that we use. If you ever need hyperbaric chamber services, let us know. Because again, look, I can't focus. I can't focus. This is in the background. All right. So, story number 107, right? So, check this out. We had a patient one time that came and stayed at the house that clearly was with a surgeon that was off roster. Now, what does off roster mean? Off roster just means that it's not a surgeon that we've approved because they haven't gone through our approval process to be a part of our network or our roster of surgeons that we quote for and that we work with or that we promote for, that we suggest, right? Point blank, period. Anyway, she came to stay at the house, and this guy had to take care of her. Well, I get a text message, and I'm like, what the hell? So I pick up the phone, and I'm like, okay, talk to me. What's happening? Well, turns out that the patient came home from surgery, and after having her procedure done, she had a lump that had developed on her side. Now, this patient went to surgery, again, had a surgeon that was not on my roster, so this patient didn't have surgery at a place we were familiar, and because they were having surgery in another facility, they were having surgery at a place that didn't allow outside nurses, and so whoever it was that took care of her that night was not somebody from my team, right? Just putting that out there. Well, anyway, she comes home, she fast forward, and she gets back to the house, and this one is looking at her and notices that when they took off the faja, she developed this ball, this tennis ball size lump that she developed in her side near her rib cage. We didn't know what this was about. We didn't know what was going on, but instantly we knew that something was very wrong. Anyway, although she's not with one of my doctors, she decided to stay at the house. And of course, who are we going to ever say no to? No. We can handle any situation, so we've got her here at the house. She decides that she's going to go to surgery. She goes to her pre-op. She gets approved for her surgery. She goes to surgery. She has her surgery. She has an overnight nurse that's assigned to her by the clinic, not even by the doctor, because apparently the doctor that she has... Anyway, apparently the doc... You're interrupting my thing. So apparently this surgeon works out of a clinic that only uses its own nurses for overnight. So we didn't have any kind of control about what was happening with her or being able to even monitor her immediately after surgery, right? Which was like our first, we don't like this thing. So right away, I'm jumping into my WhatsApp and I'm looking for the surgeon's number. And I'm like, okay, I got to reach out to the surgeon. But, you know, my surgeons at least respond to me. And when I tell you they respond to me, I mean within 4 or 5 minutes. Usually, if anything, that's a long time, to be honest. So when I didn't get a response back right away, I kind of was like, hello. And I wrote again. Well, eventually time passed. I picked up the phone. I got sent a voicemail, which then led to a text message. And this text message told me something special. You guessed it. Although we were having a medical emergency, this doctor wanted to make sure that we understood he was out of office. Meanwhile, I'm over here trying to manage a whole entire medical emergency while he is enjoying the sunny skies on his way to a beautiful family vacation with whoever he's going on this family vacation with. And of course, this is my attitude. Of course, I'm like, really? How careless is that? What a wise choice you're making to leave your patient immediately after surgery. But whatever, neither here nor there. I'm not a surgeon, right? So who am I to say? But whenever I've seen this happen, it's not gone well. So what happens? In dealing with this patient, we realized that she has a ruptured blood vessel. And when a ruptured blood vessel or a vein is leaking inside of your body, usually the blood has nowhere to go. Why? Because the veins are how the blood moves around. So when a vein is busted, you're going to get a collection wherever it is that you have that vein open. You understand? And so in this case, this patient had a collection happening in their rib area. And it was not pretty, honey. I had multiple conversations over 2 days with the surgeon, basically where I told them I was sending her back to the emergency room, which I did. They basically saw her vital signs, saw her okay, saw her in good spirits, and sent her home until her surgeon was back. I told the surgeon that I wasn't going to keep her in the recovery home, that I no longer felt comfortable, that I was going to report the situation, blah, 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 if action wasn't taken, because at this point it had been several days, the bump was only getting bigger, and nothing was happening. Well, of course, he was gonna try to save himself a trip, and so he sends this happy lady who is nothing more than a massage therapist. Like, listen, lady, we have one of the top recovery homes in the country. My husband is one of the dopest massage therapists out here who does drain maintenance and who does post-op care for some of the top surgeons in the country. We don't need you playing I Spy. Okay? I don't need you coming over here to look at things to know exactly what I already know. So anyway, what happens? We send her on her way because she comes and she's like, oh my God, this is terrible. She needs to go to the emergency room. No shit, Sherlock. So I send her back to the hospital. I call the doctor. I'm like, you've got to figure this out. And guess what? Not only did she go back to the emergency room in a rush, but she ended up having to go back into emergency surgery. She ended up having to have that portion of her body cut open so that she could have the blood taken out and have the blood vessel that was left open sealed. Unfortunately, it damaged her results, and it created an infection which continued to brew in the inside of her body and her rib cage. When she went back home, she had to have a wound vac for quite some time and went through a lot of post-operative just wound care and maintenance just to get herself healthy again. It was really, really unfortunate. And so again, sometimes these surgeons think that they're greater than life. Sometimes that they think they know what they're doing and they know so much and they know so much better. When it comes to recovery, a lot of times these doctors have no idea what's going on in the recovery field, and they need to learn to listen to us when we're telling them, because we've seen thousands of girls and we know what happens. And a lot of times we can help save both of you guys, both the doctor and the patient. But if you don't work with us. So long story short, the patient ended up going home after that long ordeal. And not only that, but she had a horrible aftercare process once she got home, because nobody really wanted to touch her when she got home. And of course, it's easy to say, right? We never worked with that surgeon again. And if we were to hear of patients wanting to have surgery with that surgeon again, we would advise against it if they asked our opinion, because again, we are patient advocates first, second, and third, and we're going to always be honest with you. And again, I ain't trying to take that drama into my house, so I'm going to let you know exactly why I would advise against it, okay? Remember that if you need a plastic surgery quote, a bariatric quote, if you need some type of assistance with your body goals, reach out to us. You can always follow us here. Make sure that you follow our page, subscribe to our pages, like our pages, support us. It's the free way that you can support us and make sure that our efforts keep going. We're transforming thousands of lives every single year, which is such a dope thing. And so, support a girl.